Menstruation is a natural and vital process experienced by approximately half of the world's population at some point in their lives. It is a biological phenomenon deeply intertwined with human health, culture, and societal norms, yet it remains shrouded in silence, stigma, and misunderstanding. To fully grasp its significance, we must explore the intricacies of the menstrual cycle, the physical and emotional challenges it can present, and the broader implications of how societies perceive and address menstruation. By shedding light on this universal yet often overlooked aspect of human life, we can foster empathy, dismantle taboos, and advocate for better support systems for those who menstruate. The menstrual cycle is a complex interplay of hormones and physiological changes that prepare the body for potential pregnancy. It typically spans around 28 days, though variations are common and normal. The cycle begins on the first day of menstrual bleeding, which marks the shedding of the uterine lining that had thickened in the previous cycle. This phase, known as menstruation, usually lasts between 3 to 7 days. During this time, the body expels blood, tissue, and mucus through the vagina. The amount of blood loss varies, but on average, it ranges from a few tablespoons to around half a cup per cycle. While this process is often accompanied by discomfort, such as cramping or fatigue, it is a sign that the reproductive system is functioning as it should. Following menstruation, the follicular phase begins. This stage is characterized by the pituitary gland releasing follicle-stimulating hormone, which stimulates the ovaries to produce follicles. Each follicle contains an immature egg, and as they develop, they secrete estrogen. Rising estrogen levels prompt the uterine lining to thicken again, creating a nutrient-rich environment to support a potential embryo. Around the midpoint of the cycle, a surge in luteinizing hormone triggers ovulation, the release of a mature egg from one of the ovaries. This egg travels down the fallopian tube, where it may be fertilized by sperm. Ovulation is a brief window, lasting about 12 to 24 hours, and is the only time during the cycle when pregnancy can occur. The final phase, the luteal phase, begins after ovulation. The ruptured follicle transforms into a structure called the corpus luteum, which secretes progesterone. This hormone maintains the thickened uterine lining, preparing it for the implantation of a fertilized egg. If fertilization does not occur, the corpus luteum disintegrates, leading to a sharp drop in estrogen and progesterone levels. This hormonal shift signals the body to shed the uterine lining, restarting the cycle with menstruation. While this process is a marvel of biology, it is far from seamless for many individuals. Menstruation can be accompanied by a range of physical and emotional challenges that disrupt daily life. One of the most common issues is dysmenorrhea, or painful menstrual cramps. These cramps are caused by the release of prostaglandins, hormone-like substances that trigger uterine contractions to help expel the lining. For some, the pain is mild and manageable, but for others, it can be debilitating, leading to nausea, vomiting, or even fainting. Severe cramps may indicate underlying conditions such as endometriosis or fibroids, which require medical attention. Premenstrual syndrome, or PMS, is another widespread concern. In the days leading up to menstruation, fluctuations in hormone levels can cause mood swings, irritability, anxiety, and depression. Physical symptoms like bloating, breast tenderness, headaches, and fatigue often accompany these emotional changes. While mild PMS is common, severe cases may escalate into premenstrual dysphoric disorder, a condition that significantly impairs quality of life and necessitates treatment. Heavy menstrual bleeding, or menorrhagia, is another challenge. Characterized by prolonged or excessively heavy periods, it can lead to anemia, chronic fatigue, and a sense of helplessness. Causes range from hormonal imbalances to structural abnormalities in the uterus, such as polyps or adenomyosis. Irregular cycles, marked by unpredictable timing or skipped periods, are also a source of stress. Factors like stress, weight fluctuations, thyroid disorders, or polycystic ovary syndrome can disrupt the delicate hormonal balance required for a regular cycle. Beyond these common issues, certain conditions highlight the intersection of menstruation with broader health concerns. Endometriosis, for instance, occurs when tissue resembling the uterine lining grows outside the uterus, often on the ovaries, fallopian tubes, or pelvic cavity. This tissue responds to hormonal changes, thickening and shedding with each cycle. However, because it cannot exit the body, it causes inflammation, scarring, and severe pain. Endometriosis affects millions worldwide, yet diagnosis is frequently delayed due to a lack of awareness and normalization of menstrual pain. Polycystic ovary syndrome, or PCOS, is another hormonal disorder linked to menstruation. It is marked by irregular periods, excess androgen levels, and the presence of cysts on the ovaries. Symptoms include acne, weight gain, excessive hair growth, and infertility. PCOS also increases the risk of metabolic conditions like diabetes and cardiovascular disease, underscoring the importance of early diagnosis and holistic management. Uterine fibroids, non-cancerous growths in the uterus, can cause heavy bleeding, pelvic pressure, and reproductive complications. While often asymptomatic, their presence can exacerbate menstrual discomfort and necessitate medical or surgical intervention. Similarly, conditions like pelvic inflammatory disease or thyroid dysfunction can disrupt menstrual health, emphasizing the need for comprehensive healthcare that addresses the root causes of menstrual irregularities. The emotional toll of menstruation is equally significant. Societal stigma and cultural taboos often frame periods as shameful or dirty, perpetuating silence and misinformation. Many individuals grow up internalizing these attitudes, feeling embarrassed to discuss their cycles or seek help for menstrual problems. This stigma is exacerbated in communities where access to education and resources is limited. The lack of open dialogue leaves many suffering in isolation, unaware that their experiences are shared and treatable. Access to menstrual products remains a critical issue globally. Period poverty, the inability to afford pads, tampons, or other supplies, forces many to use unsafe alternatives like rags, newspapers, or even leaves. This not only compromises dignity but also increases the risk of infections. Inadequate sanitation infrastructure, such as the absence of private toilets or clean water, further compounds the problem, particularly in low-income regions. Schools and workplaces often lack provisions for menstrual hygiene, leading to absenteeism and diminished opportunities for those who menstruate. Cultural beliefs and practices also shape menstrual experiences. In some societies, menstruating individuals are excluded from religious ceremonies, social gatherings, or even their own homes due to notions of impurity. These restrictions reinforce gender inequality and marginalization, limiting participation in daily life. Conversely, grassroots movements and advocacy campaigns are challenging these norms, promoting menstrual equity, and celebrating menstruation as a natural, healthy process. Education plays a pivotal role in transforming attitudes. Comprehensive menstrual health education empowers individuals to understand their bodies, recognize abnormalities, and seek care without shame. It also equips communities to support menstruators through informed policies and inclusive practices. Schools that integrate menstrual hygiene into their curricula help normalize the conversation, reducing stigma and fostering empathy. Similarly, workplace initiatives, such as paid menstrual leave or free product provision, acknowledge the reality of menstrual discomfort and promote gender equity. Medical research and innovation are advancing menstrual health in promising ways. Improved diagnostic tools and treatments for conditions like endometriosis or PCOS are enhancing quality of life for many. The development of sustainable menstrual products, such as reusable pads or menstrual cups, offers eco-friendly and cost-effective alternatives. Telemedicine and digital platforms are expanding access to care, particularly for those in remote or underserved areas. Yet, disparities persist. Marginalized groups, including transgender and non-binary individuals, often face additional barriers in accessing affirming and inclusive healthcare. Addressing menstrual challenges requires a multifaceted approach. Policy changes, such as the elimination of taxes on menstrual products or the inclusion of these items in public health programs, can alleviate financial burdens. Advocacy for better sanitation infrastructure ensures that hygiene needs are met in schools, workplaces, and public spaces. Community-led initiatives, such as product drives or educational workshops, foster solidarity and resource sharing. On an individual level, open conversations about menstruation, whether among friends, family, or colleagues, help normalize the experience and dismantle shame. The journey toward menstrual equity is also a journey toward gender equality. When societies fail to address menstrual needs, they perpetuate systemic discrimination, limiting the potential of half the population. By contrast, recognizing menstruation as a fundamental aspect of health and human rights creates a foundation for inclusive progress. It is not enough to merely tolerate discussions about periods. We must actively celebrate the resilience of those who menstruate and advocate for their well-being. In reflecting on the menstrual process and its challenges, we are reminded of the profound connection between biology and society. Menstruation is not just a physical event but a lens through which we can examine issues of justice, equity, and compassion. It calls us to challenge outdated norms, to listen to the voices of those who have been silenced, and to build a world where no one is held back by the natural rhythms of their body. Let us move forward with the understanding that menstrual health is inseparable from overall health. Let us prioritize research, education, and policy reforms that uplift menstruators in all their diversity. And let us replace shame with pride, silence with dialogue, and exclusion with solidarity. For in honoring the menstrual experience, we honor the inherent dignity of every individual and take a vital step toward a more equitable and empathetic world.